We initially came up with the fractionated dose or dose-intense regimen with lutetium on the antibody GF-1101. This is our second foray, and we've since done a third with another drug. But the idea was, as mentioned, dose intensity. So rather than having a dose of kind of any therapeutic intervention, letting things grow and then coming in again, that maybe breeds resistant, is to get it all in lutetium-177 at a half-life of about a week. So with only 2 half-lives, there's still activity that's there, boosted again, and perhaps for about a month, we have a strong level of radiation within the tumor. And hopefully, this is a regimen that if someone's going to get cured, then maybe this type of regimen might be able to cure them. So that's where that came up. And then no one had done a dose escalation study, so we did those kind of together based on our prior results with the antibody. Non-randomized study. Efficacy looked interesting with that single fractionated cycle or 2 doses. Efficacy seems similar to a selected patient population that was getting 4 to 6 cycles at the kind of traditional vision regimen with an rPFS of 8.3 months and an overall survival of about 17.5 months. PSA response rate of 54%, again, without selection for PSMA. So efficacy looked interesting. Toxicity was, so there were no dose-limiting toxicity during the dose escalation 12-week period. There certainly were adverse events, and it's what we've come to, I think, expect. Hard to say if there was anything that was significantly different. Dry mouth, fatigue, nausea were really the common adverse events. Some hematologic toxicity, but generally few grade 3 or 4 adverse events. So, non-randomized, but I think overall, the efficacy-toxicity ratio was favorable.